Hello and welcome everybody for a webinar on the skull. My dear students, you can see this GIF. It is not here for you to scare, but it is here for you to entertain. We will be studying the anatomy of skull with full entertainment. I have brought lots of pictures, images and GIFs for you. So I welcome you all once again for a webinar on skull. My dear students, we will be studying skull in almost 3 episodes. Today is our first episode, and please remember that skull is a part of osteology. You know what you call particular study of bones of your head, and this is more important for your viva and practical examinations. Okay. So let us begin with today's first episode on skull. I hope you all know that skull is not a single entity. It is a complex of, numerous bones. Okay. So this is not one bone. This is made up of, different bones. So different bones come together to make a skull. So this is a complex of bones. Okay. Before we proceed with the study of anatomy of skull, let us have a review of skeleton, because I have talked on skeleton in details during the time of study of general anatomy and general osteology. So you know what is skeleton. Skeleton is a framework of bones and cartilages which supports our body. And the skeleton is basically divided into two parts, axial skeleton and appendicular skeleton. Here the skeleton is shown to you in only two colors. And the question which is asked here poses the color, of the answer. So what is this bluish green color part of your skeleton? It's an axial skeleton here. And what is this yellowish brown color, part of this skeleton? Is the appendicular skeleton. And if you look at the skull is greenish blue. So it belongs to axial skeleton. The skeleton is a framework of bones and cartilages. An axial skeleton possesses the skull. But what is the meaning of skull, or what is the exact definition of the skull? You can see lots of skulls here, but at least you should know one sentence about the skull as far as the definition is concerned. Well, I'll explain it to you in a precise manner. The skull is a bony structure that forms a protective cavity for the brain. So that means it is a bony structure and it is a protective, covering, or say protective cavity. It makes protective cavity for the brain. So protection of the brain is a major objective of a skull, and supports the face. What face you have it because of the bones. Depends how bones are placed in your skull, that gives you the facial appearance. Some may have a big this cheek, some may have big chin. That is because of the bony features of their skull. So in short, the skull is a bony structure that forms a protective cavity for the brain and supports the face. Okay, it is comprised of many bones. That is why I said it's a complex bone. It's comprised of many bones which are formed by intramembranous ossification and joined by sutures to make fibrous joints. So everything I have told you during the study of general anatomy, the bones get developed in our body in two ways: intramembranous ossification and intracartilaginous ossification. During that time, I told you that the bones of the skull are getting ossified from a membrane. So that is why it is called as intramembranous ossification, and they are joined by sutures. So there are so many bones. So each bone meets or gets articulated with other bone. When it gets articulated, means it forms a joint. But what type of joint, that also we have studied during general arthrology. And the joints which are formed by sutures are called as sutural joints, and sutural joints are all fibrous joints. So there are so many joints here. They are all fibrous joints. except one big joint which articulates the lower jaw with the upper jaw, you can say, and that is called as temporomandibular joint, which is a synovial joint. Here is a skull in front of you. Now if you see the skull, you can at the most separate it in two parts. Okay, the lower jaw will come in your hand, a remaining thing will come in the other hand. So only in two parts you can easily separate it. The mandible in one hand, that is lower jaw, and rest of the skull in other hand. That means if you see the skull, its skull is made up of commonly it is said that skull is made up of 22 bones. So in one hand you will get 21 bones, and in other hand you will get one bone, because mandible is separable from rest of the skull due to a temporomandibular synovial joint, and other bones are not separable because they are fixed with the sutures, and the sutures are having fibrous joints, and they are mostly meant for the growth and little movements, slight movement. Okay, so that means skull is made up of 22 bones. This is a common answer, but there is a in-depth study to say about the number of bones the skull consists of. I'll come to that topic here. Before we proceed with the total bones in the skull, let us have an overview of the total skeleton system. During general anatomy or general osteology, I have told you that body has a 206 number of bones. That is a regular number. And in that, there are 80 bones in the axial skeleton. And in 80 bones, there are 22 bones in the skull, including mandible. But there are ear bones called as ear ossicles, and they are present in the head. So we can add these 6 bones to the 22, and it makes 28 bones in the skull. But there is one throat bone which doesn't come in the thorax, which doesn't come in the head, and it doesn't come vertebral column, and it is single bone, and that is hyoid bone. So usually the anatomists count hyoid bone, it is just below the mandible. So it is counted in the head. So we get 28 plus 1, 29. So if I say that there are 29 bones in the skull, my answer is correct. I have to tell there are 29 bones in the skull, including ear ossicles, including your hyoid bone, of course, including mandible also. If you see there are 21 bones in the skull, it means that excluding mandible, excluding ear bones, excluding hyoid bone. So including and excluding this word you have to add in order to explain the exact, exact figure of number of bones in the skull. Well, other bones which you see in this list are, they belong to thorax, vertebral column, shoulder, upper limb, lower limb. That is not a part of study of today's webinar. So directly we will go to the axial skeleton now. I told you that skull is a part of axial skeleton. So we should know total number of bones in the axial skeleton, and there are 80. And if there are 80 bones in the axial skeleton, how many bones are there in the skull? You have to take cranial bones 8, facial bones 14. So they become 22 bone once again. So 22 number you have to keep in mind, including mandible. Then you add hyoid, it becomes 22 plus 1, 23. And if you add ear ossicles, because there are 3 on each side. Okay, ear ossicles, or you can call them as ear bones, stapes, malleus, and incus. They are present in the middle ear cavity. So they are separate bones. So you can count them, 3 on each side, so total 6. So your number of bones in the skull becomes 29. So including, excluding this word you have to use while telling the right answer. Okay. Now we don't have to concern about vertebral column, sternum, ribs today. So we'll go directly to the next slide. Now here is a table in front of you that explains you total number of bones in the skull. So you have to give consideration to all these 4 different bones. Cranial bones means bones of head are 8. Facial bones in the face, they are 14. Okay. Hyoid bone, there is only 1 here, there below the mandible, and that is 1. And ear ossicles in the middle ear, there are 3 pairs, so 6. So altogether there are 29 bones in the skull. So 29 bones in the skull, if you say, the examiner may get confused that he knows only 22 bones. That is why you have to use this word. So there are 29 bones in the skull, including hyoid bone and including aerocycles. This is how you have to explain. It becomes a more precise answer. Well, I'm talking about these bones of the skull. We have classified them into, actually 4 categories. The first category is of cranial bones, and there are 8 of them. If you look at these bones carefully, there are 2 bones, parietal and temporal, which are in 2 in number. That means they are paired. Rest of them are 1 1 1. That means they are unpaired. So in the cranial bones, 4 bones are unpaired and 2 bones are paired. So altogether there are 6 types of bones, but total number is 8 because of pair. Similarly, if you come to the face, there are total 14. But if you see this table, there is only one mandible, only one omar. So 2 bones are unpaired. Unpaired means jodi nahi. And bakiche jodi na. So jodi ahe. So inferior nasal concha is 2, maxilla is 2, nasal bone is 2, palatal is 2, zygomatic is 2, and lacrimal 2. So 1, 2, 3, 4, 5. 5 2s are 10, 6 2s are 12, 13 and 14. Okay. Altogether, if you see total paired bones in the skull, these are 6 plus 7 plus 8. So there are 8 paired bones, and there are 1, 2, 3, 4, 5, 6. 6 unpaired bones, or if you consider all 22. And when you come to the aerocycles, there are 3 paired bones, or total 6 bones: malleus, incus, and stapes. Hope you got it. And here again, hyoid bone is not included. If you add that, the number becomes 29 number of bones in the skull. Well, I hope you understood the number of bones and the names of the bones. These knowings of bones will come to you again and again for 3 days, because we are going to deal with the study of skull for 3 days. And all 22 bones, all 29 bones, we are going to separately study. Okay, each one of them. Now look at this image. All those 22 bones have scattered. That means not only mandible, each bone is separable from the other. Here you can get a frontal bone separate from 2 parietal bones. This is unpaired, and these are 2 paired. You look at the color, you can get to 2 colors at a time. They are paired. If you get only 1 color, they are unpaired, like mandible. And some may ask me, what about teeth? Because there are 32 teeth in an adult human being. If you add those 32 separate bones, because teeth are bones, I told you in general anatomy. If you add them, so 29 plus 32, the number goes very long. But these teeth are not considered as a separate bones. They are considered as part and parcel of the jaw. That means lower 16 teeth belong to the mandible, and upper 16 teeth, they go 8 in each of the maxillae. So there are 2 maxilla bones, so 2 together we call maxillae. Upper jaw is in 2 pieces because it is separable, whereas lower jaw is 1. So this is a unpaired bone, and maxilla is a paired bone. So we get 8 plus 8 and 16. That is how we come to total number of bones in the skull as 29, including hyoid bone and including aerocycles and including mandible. Otherwise, the separable bones, if you separate, you will get only 21 bones in the skull. Now this is a image to show you the separate bones. Then later on we are going to study each bone separately, because that is the in-depth study of a skull. And osteology is my favorite topic. I'll make it your favorite topic as well. If you stay with me for 3 days, you will come to know the exact and total knowledge about the osteology of skull, or we can say anatomy of skull. Well, here is an image in front of you which explains 2 sets of bones which make up a skull. 2 sets of bones. They are divided into 2 sets. Cranial bones, 8 in number. Facial bones, 14 in number total. Okay. And you can see cranial bone again divided into 2 parts. Calvaria, this is called as calvaria or skull cap. or cranial wall. Okay, skull cap, skull topi. And then there is a base of skull, the cranial base. It is also further having three divisions: anterior, middle, and posterior cranial foci. And around that foci, there are bones forming those foci. And face, of course, we have got a 14 number of bones. We can see here is a face, bones of what we call bones of face or facial bones. And here you can see bones of cranium or cranial bones. Okay, two sets of bones. These are the, this is an image to show you the cranial bones, and some of the features also shown to you: coronal suture, squamous suture, lambdoid suture. And these are the facial bones, which includes mandible also. We'll go to that division later on. Now let me talk about those 8 cranial bones once again. I told you that actually there are 6 bones, but 2 bones are in pairs. So we altogether we get 8 bones. Okay. So let us talk about those 2 bones which are in pair. Parietal on my head, 1 and 2. Temporal, 1 and 2. Okay. Rest of them are in the midline. So from anterior to posterior, if you go, the lowest one is ethmoid, then comes frontal, then in the back comes occipital, and then in the center comes sphenoid bone. You can see the sphenoid bone is in the center. Actually, sphenoid bone is the center of the skull, and ethmoid bone is the deep from anterior side. Otherwise, frontal, parietal, occipital, and temporal, these are 4 flat bones which makes up the main part of the cranial wall. So altogether there are 6 types of bones, so 6 different bones, but 2 of them are in two on paired, so we get total 8 cranial bones. Here you can see the bones of the calvaria, or you can say bones of the cranium. I told you there are total 8 bones because 2 of them are paired. The temporal bone is 2 number, parietal bones are in 2 number. So here you get 4, and plus 1, 2, 3, 4, they are single: frontal, ethmoidal, sphenoidal or occipital, or frontal, ethmoid, sphenoid, occipital. They are the single bones. You can see in this picture once again. And paired are temporal and parietal. Just apply your mind. You have skull with you. Everybody has a skull. I don't think there is anybody here in the room on the Zoom who doesn't have a skull. If you don't have a skull, that means you don't have a head. And if you don't have a head, means you don't have a brain. We are going to do brain study later on. But remember, you are studying your own head, your own skull. So there is nothing, difficult to catch up these terms. While studying a skull, you should have your own skull in the hand, not your own skull from your bone set which you purchase for the study of anatomy. You should have it in the hand. That will become more easy for you, because we are actually doing an online study. I can't explain it to you having a bone in my hand. But I have brought so many pictures here that will make you understand thorough knowledge of anatomy of skull. Now let us talk about the bones of the face. And there are 14 facial bones. Here also there are more paired bones and there are less unpaired. So we'll take less first. There are 2 of them, only 2: mandible here and femur here in the center of the face, the posterior side behind the nose. Okay, so this is femur and this is mandible. So these are only 2 unpaired bones. Rest of the bones are paired, and there are many small bones also. We'll take first big bones. Okay, now the big bone is first biggest bone here is maxilla. Maxilla means bone of the upper jaw. Upper jaw is having paired bones, whereas lower jaw is having only 1 bone. So maxilla, 2 of them together called as maxillae. And on that side, either side of a cheek bone is called as a zygomatic bone. Here, zygomatic bone. And this portion is called as zygoma. So zygomatic bone. And then there is a small bone on the base of your nose, nasal plate. So nasal bone. On the side of nose, in the eye middle wall, there are 2 lacrimal bones. And inside the nose, on the lower part, there is one. You can see this light green color, inferior nasal concha. It's called an inferior nasal concha. So there are 2 of them. We call them as inferior nasal conchae, CHAE. So altogether, actually total number is 14, but number of bones, if you go type name wise, they are 12 of them. Okay, 1, 2, 3, 4, 5, 6, 7, 8. 1 and 2, Omer, and 1, 2, 3, 4, 5, 6. 6 of them are paired. So 6 twos are 12 and 13 and 14. So altogether you get 6, 7, 8. So you get 8 different bones, but the number is 14 because 6 of them are paired and 2 of them are unpaired. In whole skull, if you say 6 are unpaired, 4 in the head and 2 in the face, 6 are unpaired, and altogether 8 bones are paired. So we have to tell part wise or total bones in the skull also. Here you can see the facial skeleton, number of bones sure, unpaired mandible and vomer. I told you that. And paired bones are maxilla, nasal bone, lacrimal bone, palatal bone, zygomatic bone, and inferior nasal concha. Okay, so these are the actually 8 different bones, but because of paired we get 14 number of bones in the face. Well, here is a anterior view of the skull. You remember these pictures, try to imprint them in your brain, because on the last day I'm going to take a virtual quiz on these images. Don't forget that. You have to answer my questions on the third day of study of skull. All these pictures will come again in front of you for a virtual quiz. So try to remember. For example, let me take you to the inferior nasal concha. Here there is an inferior nasal concha which is shown in green color. When the word inferior comes, that means there should be a superior, because inferior means there has to be something superior. So there is a superior, what you call, nasal concha, superior nasal concha up there. Then there is a middle nasal concha here. And this superior nasal concha and middle nasal concha are the parts of the ethmoid bone. So ethmoid bone we have counted, but inferior nasal concha is an independent bone. Superior nasal concha and middle nasal concha, these are the parts of the ethmoid bone. So remember these certain exceptions which we come across, okay? And remaining parts we are going to study separately. So for example, frontal bone we are going to study separately. What this portion of frontal bone is called as squamous part of frontal bone. What is this part called as, portion between the two eyes above the nose, where you put a tira or a tickly, that portion is called as glabella. So these are landmarks which we should know. Well, you can see the mandibular symphysis, or it is also called as symphysis menti, just like symphysis pubis on the pubic bone, on the pelvic bones, where the two pelvic bones meet together, symphysis pubis, and this is symphysis menti, or also called as mandibular symphysis. You can see two mental foramina. This mental has got nothing to do with this mental. They are mental because they are foramina on the mandibular. Mandibular means mentum. So these are the different 22 bones in the skull, which we are going to study individually one by one when the region wise. First we will be studying bones of the cranium, and then we will be studying bones of the face. The same skull, if you see from behind, you can see the behind posterior bones which are placed posterior. Main bone is the occipital bone, main bone, and you can see parts of the parietal bone, and this is the back side of the jaw. So you can see the teeth. Don't consider the teeth are also present on the on back, because it's a tilted skull which is showing you the posterior part of the mandible and posterior part of the teeth. You can see the remaining parts of the remaining bones from any view, from front view, from back view, from superior view, from inferior view, from lateral, right lateral, left lateral. Lateral are one and the same. One lateral you should know. So these all sides, if it is placed in front of you, you should be able to explain it. Okay, so we call as norma frontalis. Okay, This is a posterior view, norma front posterioralis. You can see the suture, lambdoid suture here. Okay. Here, this is another view, norma lateralis. So lateral view of the skull, or norma temporalis, because the main bone in this region is a temporal bone. A temporal view also we call it as. From this side, if you see, you can see the suture here. You can see these two bones, parietal bone, it's totally seen. And this temporal bone is fully seen here, part of the occipital bone, lateral side of your mandible is seen here. Zygomatic bone is seen. You can see the zygomatic arch, which is formed by the two bones, zygomatic from front and temporal from behind. And small points. You can see the meeting point of all this 1, 2, 3, 4 here, pterion. Okay, here you can see the pterion. Likewise, and here is a superior view from above. If you see frontal bone, occipital bone, and two parietal bones, and I can see the sagittal suture, and you can see the lambdoid suture. You can see the coronal suture. Well, this is the anterior side, and this is the posterior side. And from inferior side, you see all the most of the holes or foramina, many of them, and how hard palate is formed. It's a foramina magnum, and mostly small holes. We'll come to all those foramina one by one tomorrow. I'm just trying to show you the views. And this is the interior of the skull after removing the calvaria, skull cap. What you see from inside, you should be able to tell the frontal bone is seen inside. You can see the part of ethmoid bone is seen here. You can see here you can see more properly the sphenoid bone, parts of the temporal bones. Here you can see the occipital bone. You can see the foramina magnum. So these things are actually asked in the viva practical examinations for demonstration, and that is why every part is important for you. Well, only about cranial foci. If you see, this picture is very good picture. The interior view of the skull from above, if you see, you get three fossa on each side. This is anterior cranial fossa, this is middle cranial fossa, and this is posterior cranial fossa. So they are paired. So they are called as cranial foci because different lobes of the brain are placed here in these foci. For example, anterior lobe, middle lobe, and here not posterior lobe. Here there is a cerebellum located. And well, with this, I have completed the introductory part of the skull. Now let us go and understand the bones of the cranium. Means we have to study 6 bones here. I'll go a little fast because we have less time, and we have already covered this. So the 8 bones of the cranium form the vault, and that includes the brain, and they include parietal, occipital, temporal, sphenoid, ethmoid bones, and frontal bones. 2 of them are paired: temporal bone and parietal bone. Sorry, but temporal and parietal. Sphenoid bone is 1. It is a mistake here. There's a mistake. So 2 and 2, sphenoid bone is 1. Now let us study first frontal bone. You look at the frontal bone, this separate frontal bone. This is a glabella, this is supraorbital foramina, orbital plate. Some part of orbit is formed by the frontal bone. You can see the nasal spine here. You can see the zygomatic process. Means this zygomatic process is going towards zygoma. So this is called as zygomatic process of frontal bone. So likewise, you have to remember all these things. It is called as a frontal bone because it is located in front, and it has an anterior cranial fossa for the anterior lobe of cerebellum. It forms orbit also. There is supraorbital foramina, and it encloses the frontal ear sinus, one of the coronary sinuses. Now we'll go to occipital bone. This is the occipital bone separated from the skull. You can see a big hole, biggest foramina in the body in any bone has. And this one is foramina magnum. Magnum means big. And you can see the squamous part and different parts of the occipital bone: superior nuchal line, inferior nuchal line, external occipital protuberance. You can see on the lower side condyles which take part in formation of atlanto-occipital joint with the first vertebra. These are the occipital condyles. Here you can see condylar canal. Okay, here you can see the pharyngeal tubercle. Here you can see the hypoglossal canal for the 12th cranial nerve. So these are the parts of occipital bone. You can see the occipital bone in a colored images. Here you can see the superior nuchal line, inferior nuchal line, and in the center you can see external occipital protuberance. This articulates with the atlas vertebra. So these are the occipital condyles, which make an atlanto-occipital joint, which is the ellipsoid variety of a synovial joint. Attachments for the neck muscles are provided here on this part of the occipital bone. You can see a hypoglossal canal here for the passage of 12th cranial nerve, and there are many other structures passed through foramina magnum. Here you can see the remaining structures of your occipital bone. You can see the sutural bones here in the lambdoid suture. I talked about sutural bones. Sutural bones are extra bones, accessory bones. Another sutural bone is shown here. And what you see remaining thing, if you see lambdoid suture clearly, you can see the part, what you call occipitomastoid suture, because it is between the mastoid part of the temporal bone. Okay, this is the mastoid process of temporal bone. And with this, we have completed two bones, that is frontal bone and occipital bone. Now we'll go to temporal bone. This is in pair, one each side. एक bone शिकला की आपण दोन्ही शिकलो. So it has got a squamous portions. Okay. Then it has got a mastoid process here. Then it has got an external auditory meatus for the purpose of ear. Then there is a styloid process here below. These are for the muscular attachment. Okay. And then there is a mandibular fossa here. And then there is a zygomatic process here, which gets articulated with zygomatic process of zygomatic bone, and that forms a zygomatic arch. Well, here you can see remaining parts of the temporal bones. You can see zygomatic process, and you can see zygomatic process of temporal bone. And together they are uniting here to make a temporozygomatic joint, and this together makes an arch. It's called as zygomatic arch. And same meatus you see, mandibular fossa you see, stylomastoid, fossa you see here, styloid process you see here. It is located on the lateral side of your head. Temporal bone from below, if you see, you can see foramen lacerum, which is closed. Actually, it is between temporal bone and the sphenoid bone. You can see the jugular foramina. Okay, here for the jugular, internal jugular vein to start. Okay, internal auditory meatus means for the opening of ear inside and for the passage of two nerves, 7th nerve and 8th cranial nerve. And you can see carotid canal here for the entrance of internal carotid arteries in the head. So these are the things from below. Another structures you see from lateral side, remaining things I told you the same thing is getting repeated here once again, but you can see the styloid process and mastoid process marked here. Other processes, zygomatic process. Okay. Now we'll go to parietal bone. Now this parietal bone is almost square. Okay. There are no more complex things in parietal bone. It is situated at the top, and it is a paired bone, one on each side. You got 4 sutures: coronal suture, lambdoid suture, squamous suture. Squamous suture is between parietal bone and temporal bone, and there are 2 of them because one on each side, and one is sagittal suture up above, which comes from behind the frontal bone up to the lambdoid suture. You can see the tiny irregular shaped bones that appear within the suture, which are called as sutural bones. Okay, and we have come to a sphenoid bone. If you look at this bone, sphenoid bones look like a butterfly. So the spinous word in Latin is means butterfly. It looks like a butterfly, so it is named as sphenoid. Yeah, so it has got a wings because butterfly has got a wing. So this is a big wing, so it is called as a greater wing, and this is a small wing, so it is called as a lesser wing. So greater wing, lesser wing, and the body, these are the 3 main parts of sphenoid bone. But rest of the things, small things, if you see, there is a stela turcica where pituitary gland is located. Then you can see the optic canal, which are the holes for the passage of optic nerve to the eye. Then there is a foramina rotundum here, foramina oval here, foramina spinosum. These 3 foramina are for the passage of 3 branches of trigeminal nerve. And you can see the 4 clinoid processes, 1, 2 on further side, which are called as anterior clinoid process 1 and 2, and these 2 are the posterior clinoid process. And this is body of sphenoid. Another picture, if you see in the whole skull, it looks like this. And sphenoid bone, all these foramina once again, and same thing repeated here once again. I can see there are lots of views of your sphenoid bone with me. And the last bone is ethmoid bone, this highly complicated bone. If you see, it has got a perpendicular plate here. It has got a superior and middle nasal conchae, because inferior conchae is a separate bone. You can see the cribriform plate of ethmoid. You can see the crista galli here. This is the deepest skull in the bone. And here you can see another pictures of ethmoid bone. same names I have given to you. Independent bones. You can see from this side, this is ethmoid bone, okay? And these are the bones of the face we study later on. And I think that we have finished the bones of the cranium. There are 6 of them, but we get 8 number because of 2 bones having pairs. That is why we get all together 8. So we have finished 8 bone study today, and we'll come back tomorrow with the remaining part of the study of skull, that is bones of the face. And this is time to take a break. And already my uh, alarm has gone up high. With this, thank you. Thanks a lot, and have a nice day. See you tomorrow morning at 10 o'clock.